Today we're going to be talking about 5 things that we should not say when going to the ER and what we should say instead. Welcome to another episode of Dr. Simone Says. My name is Simone Eastman Yuan. I am a medical doctor with sickle cell disorder and also a best-selling author. But these days I like to spend my time making sure that every sickle cell survivor becomes a sickle cell thriver, because it matters that you live well. Now, I know that you've all had your experiences with going to the ER and having a negative response, but looking at the amount of negative responses that we have, I sometimes wonder what we could do to change it. Now, I know that disproportionately we might be singled out because of the nature of our illness. It's a very painful illness. I would never have believed that you could feel this much pain in a body and still live, but I have lived to experience that with my sickle cell disease. So I know that your pain is real. You do not have to prove that to me. However, I do believe that sometimes we could project very wrongly, and the emergency room staff that will see us will get the wrong message because of the signals that we might be sending out that we may not be aware we are sending out, even when we are genuinely in pain. So, being that I have had a seat on the other side to witness both sides of this encounter, I wanted to take time to tell you some things that you should not do and how it could possibly be coming across and what you could probably say instead that will help and will make your experience in the emergency room and your hospitalization a much better one. The first thing is, when you arrive to the emergency room, please do not tell them you need pain medication. We know that that is what you will ultimately need to manage your pain, but what you really need is pain management. And pain management oftentimes will not come with your recipe of prescribed medications. Now, I understand that for many of us, we know the regimen that helps. We know that, for some, it will be morphine. For some, it will be Dilaudid. For some, it will be Demerol. For some, it will be something else. But I am suggesting to you that let that not be the first thing that comes out of your mouth. So, regardless of where you're at, let them know that you're here for pain management and there is something triggering your pain. Now, I have spoken in previous episodes about pain triggers, and that there are 3 general classes of pain that needs that specific type of pain management. It's like a lock and a key. So there's inflammatory pain, inflammation. If you were to try to give nerve medicine for an inflammatory pain, it would not work. It would be the wrong key in the lock. So you have to be thinking about what type of pain might be happening, and and I know you're no expert, but just if you know what kind of pain is happening and what you might need. So if you know that there's a sore spot on your body, it is likely you could be having inflammatory pain, and that kind of pain will only be helped with an anti-inflammatory. So when you go in, you need to say, I need pain management, and I think that there's some inflammation somewhere that's triggering a sickle cell crisis. So this is what I would normally take for my sickle cell crisis, but I believe that there might be something that's being triggered. Maybe I have an infection. Can you check? Can you check my Metaport? Can you check my blood? Because if it's an infection, my pain will not go down until we manage it. And so they can hear from that conversation that you are not just comfortable with just getting pain medication, but that you want pain relief. And so you're open to them figuring out what is causing your pain to be triggered and reversing it. Um, if it is nerve pain, if it's like along your spine or your neck, it's likely to be nerve pain, and it can burn, but it can also throb. So you may not be aware that nerve pain is causing stress on your body, and that is actually triggering a sickle cell crisis, because stress will trigger sickle cell crisis pain. And so, and it can be a situation of the chicken or the egg. You could have a sickle cell crisis because the weather changed. The sickle cell crisis could block circulation to nerves and cause nerve damage. Now you have nerve pain. Now the nerve pain is causing stress. Now, because there's stress, it will cause further sickle cell crises, crisis pain. And so you now have a combination pain with nerve pain and crisis pain. And if you don't treat the underlying nerve pain, you will continue to trigger a sickle cell crisis. So you want to be able to show that, you've been thinking about this, and that you know that it can come from more than one source, and you know that you may have more than one thing to treat as far as pain management, and it's not just going to be Dilaudid or morphine or whatever, but it might be that you need a nerve pain medication. It might be that you need an anti-inflammatory. Almost always you will have an anti-inflammatory, you will have an inflammatory component and need an anti-inflammatory. So even if you were to say, do you have Toradol? I hear that that is good for inflammation in the body, and I think that there's a part of my body that feels inflamed. When I touch it, it really hurts, and the stress of that could be causing my body to be triggered, and that could be why I'm having a sickle cell crisis. So can we at least work on that? Because maybe if we work on that in time, I won't need as much pain medication. But right now, this is about where I am. I'm about a 10, and I will need to start here, but hopefully we can get it under control. Just the sound of them knowing that you are thinking that it could possibly be under control, and that you're not gonna be getting like boatloads of narcotics indefinitely, calms them down. Remember, this is an emergency room. They could have seen somebody OD on street drugs. They could have seen someone arrive with gunshot wounds to the chest or the head and died. And so they are also getting their own share of trauma in the ER, or experiencing their own case of trauma. So they then come, to you, and, they don't want to lose another life. They want to preserve your life. And so when they hear, just give me pain meds, just give me narcotics, it sounds to them like another case of someone wanting them to be their drug peddler and getting a high at their expense, and they don't like that. And so they will resort to their old ugly behaviors, which is not justified, but I'm just explaining. I'm not saying it's right, but I understand. They'll resort to their old ways of thinking. They'll start thinking that you may be not needing the medication, um, and then you end up with a bad experience where you could have had a better one. So I'm just trying to arm you with the information. So, and then, like I said, if you reassure them that once things are stable, that, you're likely not going to need these large amounts of medications that you're going to need right now, um, they are more likely to feel a sense of relief because they now know that you are, you're seeing yourself progressing, not just staying in this one spot. For nerve pain, you might ask them to try a lidocaine patch. Um, there are natural things, of course, that for all of these types of pain, but I'm talking about your experience in the emergency room, and this is what they will have to offer. Um, Please, I have actually been in the presence of someone who said, push it fast. That sounds, that sounds like you're there for the drugs. Okay, I'm just saying. Okay, I am on your side. I am just saying, when you say that, that sounds like you're there for drugs. Push it fast does not sound like you're there for pain therapy. It sounds like you're liking the high of the drug. And I know you have legitimate pain, so please don't make it sound like you don't. Um, Unless you qualify that statement by saying, when you push it slow, it makes me itch, or when you push it slow, it makes me nauseated. So can you just do it quickly? If that's the case, I don't know why you're asking for it to be pushed fast. I get a headache, so I really can't relate to that part, but you may well have a legitimate reason for saying that. I'm just saying, they cannot read your mind. So make sure that you say what that reason is, because it could be very reassuring to them that, oh, okay, actually has a problem. Okay, number 3, don't sigh when you get pain relief, and say, things like, that feels good, or any of that. I also have been in the presence of someone who said that, and I thought, oh my gosh, I know that they're probably just wanting to cry, from just getting some pain relief, but saying it that way is not going to be helpful at all. It's going to make them think that you are actually, um, you're actually enjoying, um, the that you're that they've become your drug pusher, and you're enjoying a drug high at their expense. That's how it's going to sound. So if you want to, think about what it is that you're really feeling, like, wow, I am so grateful for that pain relief. I just felt my pain go down. That's fine to say. But they can't read what's in your head or in your mind. So you really do have to communicate that. Otherwise, that's what they're going to be thinking. And the 4th thing, don't get distracted with your phone. A lot of times, the doctors or the nurses will walk in there, and we're so distracted with our phone, and they're wondering, how could we be in so much pain, and laughing and talking on the phone, or busy, typing on the phone. I know that that can often be a distraction from pain. I have lived that. I have seen that. I've experienced that. But again, these are human beings, and they have their fears in their head. And so it doesn't hurt to be able to say, you might just be trying to get a hold of your family, or make sure that somebody picks up your kid, or whatever. Say that when they come in, like, gosh, I have so many people I need to contact just to make sure things are still okay on the outside while I'm in here. Whatever. I know that for some, you can take this the wrong way, and it can sound like, oh, I have to play this role. But I can tell you, being on the pain management team at Stanford University School of Medicine, I saw patients that were all Caucasian many times go through the same thing. And because doctors are scared about pain management. They ended up with these same altercations and misreading how patients are doing and what they should be able to do if they're in pain or not. I'm just saying I didn't create the broken system. I'm just telling you how to navigate it. So this is what you can do to be able to avert that problem. And 5, don't cuss people out. I mean, they're, like I said, they could be coming in from a horrendous uh, situation, and then they walk in and they're having to deal with your situation. Please don't make it harder for your care. I'm not saying you cannot raise your voice. I'm just saying that the words that are coming out of your mouth should not be demeaning to people. Because if you're saying that they're demeaning you, 2 wrongs do not make a right. I hope that this was helpful. Until next time, this is another episode of Dr. Simone Says, and remember, you are a sickle cell thriver and not just a survivor. If you liked and benefited from anything in this episode, please do me a favor, like this video, subscribe to the channel, and share with at least one person. Share the link with at least one person as your good deed for the day. Have a great day.